For Gena Asher, her journey with Bloomington Hospital Cancer Services began with an annual mammogram that was anything but routine.
The first thing everybody thinks, I'm sure, is I'm going to die. And of course the first thing I thought of was there won't be anything for me in my town. I'm going to have to go away and get help there.
Gena's decision to seek second and third opinions, even those from outside Bloomington, was supported by cancer educators at the Alcott Center, who often meet one-on-one with newly diagnosed cancer patients.
Selecting Bloomington for my care was a decision I could make only once I was confident in the people who were here to give me that care. I would not stay just because of convenience, not when you're talking about your life. When I was a patient in the hospital, I knew that I was getting the best there was to offer. They were looking at me, the person, not just my tumor, not just my prognosis, but they were discussing me. And I loved knowing that it was a collaboration of people.
Once Gena selected her team of medical professionals, she began to experience other ways Bloomington Hospital supports its cancer patients.
I had never had a massage before I became a breast cancer patient. What a perk. It really is therapeutic to have a massage, especially when you're in chemotherapy, and I loved it. I thought, this is the way to get through this.
Patients at the Bloomington Hospital Regional Cancer Institute have the opportunity to enjoy free medically based massage during treatment. Gena also participated in the WISE exercise program, a partnership between Bloomington Hospital and the Monroe County YMCA.
What the WISE program did for me was give me the confidence to get back out there in the world, to say I can do these things. I can't go walk the 3 miles I used to walk every day, but I can probably do half a mile this week, and maybe next week I can up that a little bit.
Stepping up as an active participant in her care, Gena took part in the free weekly support group for breast cancer patients.
And that is something we talk about. What I've seen at the Alcott Center is women come in scared. Maybe they've been diagnosed that afternoon and they've come in for help. Their world has been rocked, and the rest of us sitting there all know exactly what that feels like. We don't have the answers, but we know what all the questions are.
Today, nearly 5 years after her diagnosis date, Gena is no longer in active treatment, but is not yet ready to declare her cancer fight is finished.
I have nudged up against mortality, and I think every cancer patient feels this way. If you can get back to feeling good and being back to your kind of, not your normal self, because that normal thing is over. It's the new normal. You say, okay, I have met my mortality. I know what that feels like. I'm running from it now, and every day matters. Bloomington Hospital is a place where you can get top-notch medical care, but it's wrapped up in the people who live in your town.